Good evening. The June 28th meeting of the Human Services Committee will now come to order. Clerk, will you please call the roll?
Ms. Andrews? Here. Mr. Daniele? Here. Ms. Kaylee? Here. Mr. Lightfoot is excused. Dr. Quattro? Mr. Rocco? Here. Chairwoman Draw?
Here. Is there anyone signed up to speak this evening?
There are no public forum speakers tonight.
Okay. The next item on the agenda is the approval of minutes. You have the May 25th, 2010 minutes before you. They will stand approved until, unless the clerk is notified by any changes by the end of the day. The next item of business is on the agenda is new business. Madam Clerk.
Referral 10-192.
Moved by Legislator Rocco, seconded by Legislator Quattro. Any discussion? Seeing none, all those in favor signify by saying aye. Any opposed? No. Motion carries. Next item of business.
Referral 10-193. Amend Resolution 339.
Moved by Legislator Quattro, second by Legislator Daniele. Any discussion? Seeing none, all those in favor signify by saying aye. Nay. Motion carries. Next item.
Referral 10-194. Amend Resolution 339 of 2000.
Moved by Legislator Daniele, seconded by Legislator Rocco. Any discussion on this? Seeing none, all those in favor signify by saying aye. Motion carries. Thank you. Next item.
Referral 10-195.
Moved by Legislator Rocco, seconded by Legislator Quattro. Any discussion? Legislator Andrews, sorry.
Thank you, Madam Chair. Through you to the administration, the referral indicates that this $330,000 from stimulus funding will be used for overtime and or hiring temporary staff. Do we have an idea at this point in time how much of the money will go to overtime and how much will go to hiring new staff?
Through the chair, this is Mike Deedy, Division Manager with the Health Department. I don't have that data in front of me, but we can certainly get back to you with more concrete figures.
Thank you. And also following up on that, through the chair, since it is stimulus money and it's going to go away or only be available through September 30th, 2011, could you let me know how you plan to address these services after that funding is no longer available?
Through the chair, part of the planning with this allocation was to ensure that we weren't putting ourselves in a situation that would require additional county resources at the end of the era funding. So part of the planning that we're involved with the state is to use the funds for the short-term purposes and resources.
Okay, thank you. And lastly, the temporary staff that may be hired with these funds, is that to do work that is currently done by permanent county employees?
Through the chair, in our response to your initial question, we can incorporate the scope of work and the intent utilization of that staff.
Okay, thank you very much.
Any other discussion? All those in favor signify by saying aye. Any opposed? A motion carries. Next item.
Referral 10-196. Amend Resolution 320.
Moved by Legislator Quattro, seconded by Legislator Daniele. Before discussion, I would just like to mention now that Mike, Division Manager for the Child and Family Services, Mike Deedy, who just spoke, would like to give a little brief presentation on the Nurse-Family Partnership Program that we do here in Monroe County. So I'd like to turn it over to Mike for a little bit. Thank you.
Thank you, Madam Chair. First of all, I want to thank you for asking for the information this evening and allowing me the opportunity to update you on our Nurse-Family Partnership Program. you should have in front of you a packet that contains some recent materials from a graduation that occurred in March, as well as a newsletter that is sent out on a regular basis to various stakeholders in the community to keep them updated on the program and used for public awareness and education about the program, as well as an updated brochure that describes the program. I will try my best to be very brief on this and entertain questions if needed at the end. For those who aren't aware what the Nurse Family Partnership Program, even though if you have heard it in the news, it originated in the 1970s by Dr. David Olds and Dr. Harriet Kitzman, who is from the U of R. Over 30 years of research, he and his colleagues tested the program in randomized control trials with different populations, starting in Elmira, New York, and then Memphis, Tennessee, and then ending in Denver, Colorado. So currently it's a national evidence-based nurse home visitation program intended to improve the health and well-being and economic self-sufficiency of first-time low-income moms and their children. The home visits begin early in pregnancy and continue up to each child's second birthday. Our benefit here in this community is that Harriet continues to be a champion for the program, as well as someone locally who we can turn to for guidance and who ensures our program is doing all that it's expected to do. According to our review of our data with the National Service Office, the Regional Office, Dr. Kitzman, we are all doing very well with this program in Monroe County. Research shows that there are significant positive results of this program, including but not limited to a reduction in child abuse, fewer children hospitalized, fewer infants dying in their first year, fewer children with developmental delays, fewer children entering the criminal justice system, as well as it's been identified as the most cost-effective program of its kind by the Washington State Institute for Public Policy. At the same time, it increases labor force participation, improves school readiness, saves substantial government resources, and has a considerable return on investment. Based on our current data, as well as the recent community action plan that was released, we do recognize a need and strive to serve 1,000 families in this community. However, this type of growth and development equates to a total program funding need of approximately $4.5 million. General national data includes similar outcomes in terms of, and again, you can see this in your brochure, 48% reduction in child abuse and neglect, 32% fewer subsequent pregnancies, 83% increase in labor force, and 20% reduction in months on welfare. Our county program, which began in July 2006 with 3 nurses, currently has 8.5 nurse home visitors and a half-time supervisor, or 0.5 supervisors, sorry, and 1 program coordinator. I'd like to point out that Jobina Robinson, program coordinator, and Heidi Loomis, supervisor, are sitting behind me this time. Monroe County has challenges because we serve a much higher risk group than the national average in terms of age, household income, education, overall high-risk target population, those with mental health concerns, as well as substance abuse. Since its inception in Monroe County, we've had 48 graduates as of March, and we have 35 more anticipated by the end of the year. And to further evidence the need in this community, Monroe County birth statistics show that in 2008 there were 8,700 total births, 3,692 were first-time mothers, and 1,309 of those were first-time moms on Medicaid, which is a good substance of the NFP population. We are currently interviewing several nurses for vacant positions and just offered a part-time position to a nurse practitioner who I'm pleased to say accepted. The standouts for our program, we're constantly looking at other opportunities to rise above the status quo for the NFP program and identify ways not to only ensure the quality and fidelity of the program, but also see what ways we can enhance and build upon the program, especially given partnerships we're engaged in the community. A few other highlights and remarks on this. Monroe County has established a strong foundation and infrastructure for implementing the program. And even though we hear a lot about NFP in the media, we are very fortunate and rich with other partnerships and collaborative efforts in this community. We have strong relationships both in the county with Department of Human Services and our own perinatal home visiting program, as well as community organizations with providers like Mount Hope Family Center, SPCC, Family Resource Center, and more with whom we work closely to address issues around capacity, program effectiveness, and service needs. We do recognize as a program it's not all about NFP. again, due to the various collaborative initiatives we're engaged in, we're more likely to address the needs of each individual client and design a coordinated system of care with a strong continuum of care. And I spoke recently on the Healthy Mom, Healthy Baby grant, which is a huge umbrella of that type of design. We believe our county leadership, as well as community partners, are very proud of our nationwide reputation for being innovative in this community and establishing effective programs. At this time, I mentioned about funding. We do not believe that community contributions are likely to see any increase. That's a challenge. But we are watching very closely to federal and state initiatives, healthcare reform funding, other funding opportunities that are potentially coming our way, and being very proactive to try and utilize those and become a recipient of those. Two I'd like to mention briefly, and then I'll be done. There's TANF dollars, which is on the referral for this evening that I could speak to. The Healthy Mom, Healthy Baby grant we could utilize to enhance home visitation and potentially expand the program. And then Monroe County is actually, we're prepared at this time to initiate Medicaid claiming for the program, which was recently approved through CMS. I have to say we've been praised by the state for our efforts in this community and are actually ahead of other counties in terms of being prepared to utilize this funding and how we prepared for the effort. Even with all these and the discussions about NFP at federal and state levels, we remain hopeful, but yet we do not have any concrete or detailed information on how all the funding will play out. And we will remain diligent in our efforts to ensure we're taking full advantage of any opportunities that grow in this community. So.
Thank you, Mike. Any questions for Mike now? Oh, Carrie. Legislator Andrews?
Do you want the question specific to the referral,
Sure.
or just in the presentation, or both?
Maybe to just a presentation.
Okay.
If you,
Through you, thank you for the presentation, the information. It's a program that I have an interest in and think it's a great opportunity or great program that we participate in, and I hope to get to one of the graduations in the future when that works. Can you tell me at this point in time how many mothers we have participating in this program?
Through the chair, I apologize, I skipped right over that. I do have that right here. We have 176 current active clients, 14 pending referrals to be assigned.
Great, thank you. And can you tell me what the approximate cost per client is for the program for a year?
It's approximately, through the chair, it's approximately $4,500 to $5,000 per client.
Thank you. And you indicated, I was going to ask this question regarding the Medicaid funding. I had heard that was an opportunity for the county to have some of the cost of this program offset by the Medicaid, And can you discuss how you expect that to work, or what % of the nurse-family partnership cost can be paid for by Medicaid?
Through the chair, in working with the state, we determined it's about 35% of a nurse's time would be eligible for Medicaid claiming. Given that we're just about to begin that process in terms of claiming and submitting the data, we have to work internally to determine how that's going to impact other county funding for the program, and how it's going to be offset.
Through the chair, then, is it possible that the cost then will still be $4,500 to $5,000 per year, but we'll be able to take that 35% and have it reimbursed somehow through Medicaid, and then we'll be able to service more families? Or how do you hope that this is going to work?
Through the chair, that's what we're anticipating.
So what would be your goal then in terms of increasing the number of families that are in the program?
Through the chair, at this time, it's tough to determine exactly how much we're going to be able to expand. But referring back to the presentation, we understand the need and capacity issues in this community, want to ultimately be able to serve 1,000 families, and whatever we can do to get closer to that goal, we will do.
Thank you. I guess if you can be a little more specific, though, I understand that's certainly a long-term goal, but if we're at a little under 200 now, it's going to take some time to get to 1,000. But in terms of a short-term goal, due to the fact that we can have the 35% offset with Medicaid, is there any plan, in place now, or what you envision shortly, because you just received this approval, in terms of increasing the number of families served?
Through the chair, one of the things we've been doing through this entire process is proceeding cautiously, because there was one point in time we were told that you're going to be set to claim Medicaid several months ago. So with our best work, we've determined what the estimate for the Medicaid claim will mean, but as many of you are aware, Medicaid rules can change on a daily basis. So we hate to commit to or have a concrete plan in place until we actually start reaping some of the benefits from that claim. And when we can better project what that means, again, we have ideal goals and direction we want to head with the program in terms of expansion. But the better information we have through this, better off we'll be.
Thank you. And I understand and certainly recognize the need to proceed cautiously and conservatively. I just want to make sure that there's no chance, or I hope at least that there's no chance that due to the fact that this program is now going to be cheaper in terms of county expenditures, that money that we save is still going to be allocated to the nurse-family program partnership. It's not going to be spent in another area or to offset some other portion of the county budget.
Through the chair, again with Medicaid, we cannot guarantee at this time that the Medicaid dollars will surface. We do have directions from the state on how to proceed going forward, but again, anything can change in terms of Medicaid. The other piece is, to hopefully answer your question, and I appreciate the support on this, is that the dollars that are dedicated right now to the program are dedicated specifically to NFP, and there's no intent at this time to shift those dollars elsewhere.
Thank you. When do you expect to have any further details from the state in terms of the Medicaid piece here?
Through the chair, we just last week received the forms and notification to proceed with the Medicaid. We're working aggressively to be able to do that throughout the month of July. Mm-hmm. And then we'll be working with our finance office to turn that information around quickly to be able to claim as quickly as possible. And then we also have to determine, there is a retroactive piece to this, and we have to determine with the state how far back can we go. And as soon as we have that notification, we'll be, again, moving aggressively to retrieve those funds.
Okay. I would request if you could give us an update next month in terms of where you stand with that process, as we'll be towards the end of July. Just like to see how that plays out. Also, you mentioned earlier that it would cost about $4.5 million, I think, to service all 1,000 families. That is your ultimate goal. At this point in time, what's the county's contribution to the nurse-family partnership?
Through the chair, first of all, to answer your first question, yes, I'd be happy to give you an update at the end of July.
Thank you.
The second piece, the current funding primarily is through local funder United Way, contributes in excess of $350,000, and that contribution, equates to a drawdown from the Community Option Preventive Services dollars, COPS dollars, for the remaining round, it's a little over, I'm going to do the math, I'm sorry, between $600,000 and $700,000. I can get the exact figures for you.
That would be great. Thank you. Thank you very much for the presentation, the information.
Thank you. And again, thank you, Mike, and also to Jobina and Heidi for being here today. Dr. Doniger also for the success of that program is a tribute to all of you. So thank you very much. Back to the referral. Any other questions on that? Legislator Cayley?
Thank you. Through the chair, I may have missed this during the presentation, but are the families that are currently enrolled, is this a localized program? I know that some programs shift depending on needs in the area. So were the graduates here from countywide, or was this a localized effort?
Through the chair, this is a countywide program.
Thank you. That's it.
Legislator Andrews?
Thank you, Madam Chair. And through you, when we first heard some word about the possible state money that we're accepting today, my recollection is it was estimated to be about $500,000 to $600,000 that might be available to the county. The referrals for $255,000. It's highly possible my memory is incorrect. If so, please tell me, or if not, is there a reason why the money that we're accepting today is about half as much as we expected a few months ago when we first started talking about this?
Through the chair, the amount you're recalling, the 500,000 plus, was over 2 years. So the money tonight is for the first year of that allocation.
Thank you very much. Is it our hope then that we'll receive another $250,000 for the second year?
Through the chair, I certainly hope so.
Thank you. And the 62 families that are going to be served by this program, that's also just for the first 1 year under the $250,000. Is that correct?
Through the chair, rather than guess at my answer here, I'm pretty certain in what it is, but I want to go back to the contract that they sent us, because the dilemma I'm running into is that, you know, with 62 families are involved with the program over about 2.5 years. So I want to be certain, and there could be turnover with the TANF eligible families that are coming in. So I'd be happy to get the right information to you.
Okay. Thank you very much for all the information. Thanks.
Any other discussion? All those in favor signify by saying aye. Any opposed? A motion carries. Next item.
Referral 10-197.
Moved by Legislator Daniele, second by Legislator Rocco. Any discussion? Legislator Cayley.
Thank you. Through the chair, were there, this only lists lifespan. Were there other agencies that responded to the RFP?
Through the chair, this was RFP'd a few years ago. We RFP our programs every 3 years.
Okay.
This is additional funding. Lifespan holds the current contract for our Title V program, so this is in addition to the current contract.
Thank you. In looking, I'll be honest, I don't understand the chart.
Okay.
So if you could help me out just a little bit with the chart. I'm understanding, if I'm looking at this, it's 6 participants and then 10 participants. Am I looking, are these just straight numbers of participants for these years?
No, through the chair. Under the current allocation, without the additional funding, we anticipate serving a total of 29 participants. And what they're participating in, of course, is subsidized employment with the hopes of attaining permanent employment that's unsubsidized. The chart that you're looking at with the 6 individuals on there, we're anticipating that 6 of those individuals out of the 29 will obtain unsubsidized employment, meaning we won't use the Title V funding to pay for their employment any longer.
Thank you.
Any other discussion? All those in favor signify by saying aye. Motion carries. Are there any other matters to come before this committee tonight? Seeing none, there's no further business. The June 26, 2010 meeting of the Human Services Committee stands adjourned. Next meeting will be July 27th at 6 p.m. Thank you. Have a good night.